Good morning. I would welcome all members, staff, and guests to the June 26, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting. I would like to remind everyone that our meetings are web streamed and televised. With that, I would like to call the June 26, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting to order at 9:30. Are there any disclosures of pecuniary interests? Seeing none. Are there any additions to the agenda? None. Presentations, deputations are none. Adoption of advisory committee meeting minutes. May I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory meeting minutes from May 29th, 2023? Thank you, Councillor Van Boosey and Councillor Van Passen.
Madam Chair, could we just take them as amended?
Oh, yes, the typo. We approve those as amended for the typo. All in favor of that motion? Carried, thank you. Are there any updates on previous reports? We have an update. Bryce, thank you.
Through the chair, all reports were approved at council. Thank you.
Thank you. Are there any consent items? And then we have one closed item of business today. Can I have a mover for the following motion, please? That council enter a closed session at 9:32 pursuant to section 239(2)(b) of the Municipal Act 2001 as amended, as the matter pertains to an identifiable individual, including municipal or local board employees. The mover, please. Thank you, Councillor. Seconded. Thank you, Councillor. All in favor? Carried. Thank you. We'll be moving now.
Welcome to Passionate Folks, a blog and video series about people who live in Norfolk. People that get involved in our community, people that are passionate about living here. We sit down, have a conversation, and learn about their stories. Welcome to Passionate Folks. I am Emily. I love to connect with people. I love to ask questions and get to know people better. So today I'm sitting here with Scott. Hey.
Hi.
How are you?
Good, how are you?
Good. So Scott, to start, can you tell us a little bit more about yourself, who you are, where you're from, and where you live?
My name's Scott McCrae. I'm a chef here in Norfolk County. I'm the chef at David's Restaurant in town, and I live in Port Dover, or just outside. And yeah, all my family's from Port Dover. I moved here in high school and left for a bit and moved back, and now
Made it your home.
Made it my home. Yeah, it was my home before. I realized it was my home while I was away, and yeah.
Came back to the roots.
Yes, exactly.
So as I do with every guest, I ask you to pick a place in Norfolk County for us to do this interview.
Mm-hmm.
So tell me where you invited me and why you picked this place.
Well, we're here at Matt's Fruit Barn, just outside of town, and it was a pretty easy choice. I know we wanted something that was kind of related to what I do. We were talking about how diverse Norfolk County is as far as things that grow here, and it's like #1 for so many different fruits and vegetables. And one of the first things I always think about is just, especially considering what job I have, is food. Norfolk County produces so much food and grows so much food. This property here that Christine and Jess and the family have kind of they grow more things here than I can even think of. Like you look
It's a good
around, you might-
representation of Ontario's garden when
Exactly.
you visit this place, isn't it?
yeah. This is kind of just like a little example of what this area has to offer.
So I love to dig in people's passion and see what lights them up. And I'd love to know about you. I think I may have a little bit of an idea, but what are you most passionate about?
That's a tough one. I think definitely I'm passionate about food and what I do. That's something that since I was young, I've always associated memories. Like a lot of people with songs or with like smells or things, it'll just trigger a memory. And a lot of my early childhood memories have to do with food. There'll be a weird little thing that I remember, like, oh, that was my first like black olive I ever had, or that was like, there's a lot of memories that kind of are associated with that.
Big connections to
Big
food
ones,
and
yeah. Like
stories.
the mulberry tree in my grandparents' backyard, and we just stand for hours underneath just like eating mulberries. And
So I know you work long hours. It's a busy season for you in the restaurant. When you have some downtime, where do you like to go in Norfolk? Where do you like to have a good time?
well, I'm lucky that all my family lives here. I moved away for a while. I moved to the city. I was in Yukon for a bit. Just being back and being able to see family is I don't get to see them enough still, but it's definitely a big reason why I came back and something I like to do. Friends too, you know, just hanging out on local patios or at their house or watching Leafs games. Well, I've always been kind of, from my grandma when I was a kid, I got really into like birds. Yeah, so I mean, there's binoculars in the truck right now with the bird
Like
book.
go to Long Point or where?
Well, of course, like that's Long Point. Well, around here, like I'm lucky I live out of town. You can drive out and see the tundra swans at Long Point when they come through. It's really a mecca for that if you're into that. I'm a bit of a weird, obsessive record collector, and I've got a lot of records.
Do you like to see live music around? Is
Oh, of
there
course.
decent bands that are around that you like to?
Oh, tons. Yeah. It's great. I mean, like a lot of my friends are musicians, and there's not a ton of downtime, but when there is, it's like sometimes just things that are just nice and relaxing. It always helps when you have like a local brewery.
And there's a lot to pick from. So.
Yeah, there's a lot of great ones. It's really exploded, especially since I moved back from Toronto about 10 years ago, and even in that time, it's the wine scene, the beer scene, the ciders, like all that has just exploded, and it's all really good. Like,
So do you think, like, just back to the winery and the brewery, like, you know, after high school and when you wanted to leave and get to the city and get out of here and coming back and finding it like right here?
Well, even when I originally moved back, I was intended on going back to the city, and I came back and just realized that this is where I wanted to be. This is where my heart is. This is where I really belong, and I have friends there, but the friends that I have here are friends I've had since I was like in high school, right? So there's something there where
No, we live in a pretty cool place.
yeah, it's great.
I thank you so much for your time. I love connecting with you and learning about your passions, so I appreciate it.
Well, thank you very much. Thanks.
My name is Jim Toombs. I'm an Associate Purchasing Specialist here at Toyotetsu, also known as TTCA. Here at Toyotetsu, we're responsible for supplying Toyota with car parts, mainly automotive frame for the Lexus, the Corolla, and other Toyota models. I started here in May of 2016. I was in welding. Here I am 2 years later, and I'm a salaried position. The job itself it's challenging. There are challenges in what I have to do every day, and for that I enjoy it. It's not monotonous day in, day out. There's new challenges that I'm confronted with and new tasks that I have to do. A high school student who's like, I'm not sure, I think this is an excellent opportunity to kind of answer that question for themselves. They can see what kind of the working world is like, as well as pick up skills. There are plenty of opportunities here. For example, for me, I was in welding, but that didn't mean I had to stay there. There's opportunities in stamping, where you'd learn different skills entirely. PC, again, the same thing, some different skills needed that you'd learn. Though we make car parts and they're welded, there are a lot of departments and areas that support that.
My name's Aaron Pace. I'm a yard manager here at Townsend Lumber. We're a sawmill that produces lumber. We make anywhere from rail ties to timber frame home products, kill-dry lumber, which is used for wood cabinets and furniture. We also do pallet components, and we also do stakes for farming. We ship container loads to the Middle East, we ship it to Asia. We have gone to Mexico, Singapore. We've shipped to many different locations. My father has worked here for 30 years. He got me a part-time job as a summer student. I started as a regular piler, as a laborer at the entry-level position. And with hard work and dedication, I've been promoted through the system, and it took 9 years to become a supervisor. I enjoy the freedom of the job, like outside working with the heavy industrial stuff, talking to the range of customers and the way we produce things for them.
My name is Cam Kirkwood. I'm a production supervisor at Superior Essex in Simcoe. We make magnet wire and cable for the transformer industries. Our magnet wire products are found all around you that most people don't even notice, in winding motors, in alternators in your vehicles, transformers on the side of the road or on top of poles. I've been here at the company for 15 years. I started on the floor as a machine operator for 7 years, and then I did a stint in engineering for about a year, and then I moved on to production supervisor for the last 7. One of the best parts about working here is it is a build-to-order shop, so although we do make similar products every day, it's very unique. We don't always see the same orders. There's always new challenges. One of the best parts about being in manufacturing for me is the shift work. So it provides an opportunity for you to adjust to do your own life on your days off, or you can pursue other interests. A lot of people have second businesses or hobbies that they really enjoy. There is lots of opportunity to advance. There's educational assistance programs. You can continue to learn new skills and advance to a new area if you were so desire.
There's a great opportunity moving up the manufacturing sector.
Try it, because you're going to learn a lot about the working world as well as yourself.
Welcome to Passionate Folks, a blog and video series where I'll be highlighting people from Norfolk County who have a passion, who are involved in our community, who are the movers and shakers. So I'm excited to introduce every month somebody new from Norfolk that will bring you their story, their passion, and share it all with us. Come on in. All right, welcome to the first episode of Passionate Folks. I'm Emily, and I love to dig in people's life and getting to know more about them. I'm here with Jess today. Thanks, Jess, for showing up.
Thank you for having me. This
Yes.
is so exciting.
So just for the people that don't know you, introduce yourself, tell me a little bit more about you and the person that you are.
Sure. Well, my name's Jess, and I grew up in Waterford, more specifically Boston, more specifically Bill's Corners. I'm a passionate Norfolk advocate. I love this area. I love theater, I love music, I love anything arts related. Also a passionate advocate for entrepreneurs in the area.
So I invited you to pick a location in Norfolk that meant something to you. So tell us where we are and why you picked this place.
All right, we are here in Simcoe Little Theater. It's on the corner of Talbot and Yonge in downtown Simcoe. And this place, Simcoe Little Theater, is a very special place to me. I spent most of my life in these walls, on that stage, behind the stage, in these seats, like everywhere in this space. It's something that theater is something that's like has always been a big part of my life since I was about 8 years old.
You mentioned to me that you also in high school, you were really involved into the drama program and all that, so.
I had walked the halls of my high school and I had seen so many pictures on the wall of different shows they had done throughout the years, but nobody was doing shows anymore. And I was like really bummed about that. So in grade 10, me and my girlfriends, we roped all our moms in. We're like, if we start doing high school shows, like, will you guys help? Will you make costumes? Will you whatever? And they all jumped in.
Involved.
Yeah.
I love that, right? Like that's a small community, like
That's
everybody
it.
coming in together.
And like, that's what it requires, right? Like a show is like a mini village coming together, like making all the pieces happen.
So this community, I think the word, like you keep repeating it, and I think what you're creating in Groundswell is that sub-community within the community community, and that really stands out. So would you say this is something that you're really passionate about?
Oh yeah. Yes.
Yes, that connection,
Totally.
right? Yeah.
I just think like community is everything. We're not meant to do
May I have a motion to reconvene an open session at 9:45 a.m.? Thank you, Councillor Duffy. Seconded. Councillor Linda, thank you. All in favor? Carrie, thank you. May I have a motion to receive the update on Canada-wide early learning and childcare program memo as information? Thank you, Councillor Van Passen. Seconded by Councillor Linda. All in favor? Carrie, thank you. Staff reports. We have 8.1 social services and housing, 8.1.1 Canada-wide early learning and childcare, 2002 update. Councillor, or sorry, Stephanie. Okay.
Thank you, through the chair. I would now like to introduce Anna Moroz. Anna is our financial analyst for Children's Services Programming and the author of the report. So first of all, thank you, Anna, for completing the report. Anna will present the report, and also joining us today is Michelle Valent, Program Manager of Children's Services. So Anna, Michelle, and myself are available to answer questions after the report is presented. Go ahead, Anna.
Hi, thank you, everyone. Thank you to the chair. I'm presenting report number H&SS 23041, update on Canada-wide early learning and childcare program, which is also known as CWELC. The recommendation is that this report be received as information. Norfolk County is the Consolidated Municipal Service Manager, CMSM, responsible for planning, management, and delivery of quality and affordable childcare in Haldimand and Norfolk counties. The Canada-wide Learning Childcare Program purpose is to lower childcare fees for caregivers and provide accessible, high-quality, and inclusive childcare in Canada. The program came in effect April 1st, 2022 for those operators that chose to opt in into the CWELC program. The CWELC program has three funding areas. Number one, fee reduction for caregivers through a graduated approach to reducing daily childcare costs. Number two is workforce compensation, which aims to support recruitment and retention of childcare workforce by improving compensation for registered early childcare staff. And administration allocation, which is intended to support the CMSM's administration and implementation of the CWELC program. A little bit more about the fee reduction to caregivers. It is a graduated approach that began April 1st, 2022. And in 2022, families whose children were eligible under the CWELC guidelines received a 25% reduction towards their fees. As of December 31st, 2022, the fees were further lowered by another 37% for a total reduction of 52.75% for 2023. An example of how the percentages are calculated and applied can be found on page 9 of your agenda. The rollout of the program. The childcare providers were given until September 1st, 2022 to indicate whether they wanted to participate in the program, which was later amended to extend the deadline to November 1st due to time constraints. The daily fees that providers are able to charge are frozen at March 27, 2022 levels, which means that providers who enrolled in the CWELC program were not able to increase their rates following that date. Once the application was received from the providers, it was reviewed and approved, and childcare providers were required to issue retroactive funds to caregivers as of retroactive to April 1st to parents and caregivers. About the operators in Haldimand and Norfolk, there are a total of 19 operators with 2,552 licensed spaces in both counties. This number of spaces includes all licensed spaces for all age groups, not just CWELC eligible age groups. Of the 19 operators, 13 chose to opt in, which is 68% of all operators. The age groups that are eligible for CWELC fee reduction are infants, toddlers, preschoolers, kindergartens under the age of 6. For 2022, the total funding received from the Ministry of Education for the CWELC program is $2.5 million, which is also on page 7 of your agenda. The breakdown of the funding is as follows. $2.2 million is for fee reduction portion, $180,000 is for workforce compensation, and $125,000 is administration allocation. So 2022 was the first year CWELC program came in effect. As such, it's expected to experience challenges as all parties involved are navigating within the guidelines set out by the Ministry of Education to ensure that the operators are working within the parameters set out and to ensure that CMSMs are issuing appropriate amounts of funds, collecting the required data to support the operator expenditures, and providing accurate financial reporting to the ministry. The Ministry of Education has announced that they're working on a new funding formula for 2024, which will be released later this year. The impacts of the new funding formula are not yet known at this time. Thank you for your time, and we're happy to take any questions that you might have.
Thank you, Anna. Are there any questions? Councillor Van Tassel?
Not a question, but more a comment. In the discussion, there is a chart with the operators opted in, opted out. And there's one denied that they can't put in the number because of privacy issues. But they're less than percentage yet, so it doesn't take a genius to figure out how many spaces. So it's got all these rules on privacy. You got to make sure we cover both sides of it.
Thank you for pointing that out. Maybe we should amend that then. Councillor Duffy?
Thank you, Madam Chair, and through you. A question related to the 5 operators that opted out. In the reports on pages 3 and 4, it sort of talks about the common themes that emerged relating to the operators that opted out. And it is, I could foresee that those would be, for some operators, difficult challenges. I'm wondering if we have provided or will be providing that feedback to the ministry for potential best practices or operational improvements that could be found that are more broad spectrum.
Oh, Michelle, you're on mute.
Apologies. Through the chair, I can say that that information has been provided to the ministry.
And Madam Chair, if I may further. Yes, I can't see you quite properly over there on the screen. Is that a common theme that we're hearing from sort of other operators across the province, or is it somewhat localized to our rural municipality? I'm curious.
Yeah, through the chair, I would say that is when I'm engaging with my colleagues provincially, that is a common theme that we've heard among much other feedback regarding the CWELC program, and the ministry is going through a consultation process. I believe they've wrapped it up now, where they did engage stakeholders to get feedback on the initial implementation of CWELC, and they will be considering that in their funding formula for 2024.
Perfect. Thank you.
Thank you. Councillor Linda?
Thank you. And through you. Yeah, that is a concern that they opted out, and I think it has a lot to do with the fact this is new. It's early. There's speed bumps here and people and ups and downs and everything for them. But barring that, is there sufficient number of spaces then available within Haldigan and Norfolk, or are we looking for any further non-profit or profit daycares that would like to opt in?
To the chair, to answer your first question, I would say that we have insufficient spaces for childcare in Haldiman and Norfolk. We recently submitted an expansion plan, a targeted growth plan, to the Ministry of Education at their request, and we were provided with additional spaces that they would support from 2022 to 2025, we were provided with 245 community-based spaces and 196 school-based spaces. So we'll be working diligently to create those new spaces. The ministry standard they would like to see provincially access in each community at a level of 37%, and that is what we're working towards.
Thank you. Any further discussion? Then we'll move community paramedic and social services and housing outreach pilot HSS 23-033. Stephanie? Okay, motion received. Thank you, Councillor Linda. Seconded. Councillor Van Passen. All in favor? Carried. Thank you. Well, thank you. Go ahead.
Thank you. Through the chair, I'd like to introduce once again Program Manager Louise Lovell, who has both authored the report and will present it. Louise and I are both available to answer questions after Louise presents. So thank you very much for bringing this report forward, Louise, and please go ahead.
Through the chair, good morning to all the members of Health and Social Services Advisory. I am Louise Lovell, the Program Manager for Homeless Prevention Services, and I am bringing you the information report HSS-23-033 on behalf of the working group and implementation team that piloted this project in 2022. And we thank you for your time this morning to bring this report. The background, as we've explained in the report, was based on one-time funding that was received to implement an outreach service through 2022, targeted specifically to those experiencing homelessness in our community. And it was a project with both of the community paramedic programs in Haldimand and Norfolk, as well as a targeted group of staff from social services and housing. The basis of the project was that once a week in each of Haldimand and Norfolk, a team of one community paramedic and one social service and housing staff went out together for the day to try to support those possibly living rough in our communities. There were many logistics to work out prior to this project launching. And that took some time. So you'll notice that while we suggested that the project was approved for a year, it was implemented as soon as we could after the approval was received and those logistics were worked out. So it ran for 8 months for sure for both counties. Each team had service levels and mandates to maintain, and this project was in addition to all the team's regular duties and the additional workloads that was brought on by COVID. There were 4 deliverables identified for the project that, again, we've highlighted on page 2 of the report. We were looking to increase the connection between the 4 partner programs. Knowledge and relationships gained by cross-sector teams delivering the service weekly was going to be invaluable for future referrals and basic understanding of services available in the community. We wanted to increase the ability to connect individuals experiencing homelessness with the programs and services that they most need. Encounters with the community would be more fulsome, allowing for extended service availability. We were looking to develop external relationships between the 4 programs, along with community agencies involved in supporting individuals who are experiencing homelessness. And we were looking to have data obtained from the project, and we hoped it would help inform the demand for outreach services and evaluate future need or identify gaps in the current outreach services available. The project team received information from the community on a week-to-week basis regarding sites to visit. So there was a process that was put in place to help us receive information from community members about sightings of encampments or possibly people living in their vehicles or in abandoned buildings and so on and so forth. On the weeks that there were no reports received from the community and there were no known individuals to the homeless prevention team, the teams did spend some time trying to do community development as identified in the deliverables. We were looking to strengthen relationships in the community as well. So for example, the team spent time going to maybe the Salvation Army or maybe the libraries or other places where we know folks try to connect for information to make sure that those agencies knew that the pilot was in motion and was happening and what people could do to help support people connect to us. There was an evaluation plan put in place that included both quantitative and qualitative data collection. There were many themes that arose from the collection of that data. And the goals that we accomplished for the data, you can find on page 5. We did find at the conclusion of the project that the goal of increasing staff awareness of each other's programs and services for future client support was achieved based on the qualitative data collected in response to the question, how familiar are you with the programs offered by the other partner programs? The goal of being able to provide a more fulsome service at the first point of contact was achieved. In the 152 total interactions across the 2 counties, all were helped where needed in the individual interaction with housing and homelessness supports, health supports, and financial supports, as well as a breadth of referrals to other services if they needed them in that single interaction. There was no qualitative measure to assess any increase or decrease in the community partners' awareness of services based on the pilot, as time did not permit. However, as can be seen on the mapping of the interactions, there was significant partner engagement. The data analysis is not complete at this time. However, the pilot did achieve the goal of providing evidence to understand and inform the need and frequency required for outreach services in each municipality. And future planning will rely on this data to ensure there is an efficient use of any available resources for any outreach programming. The team again did want to thank the members of advisory and council as a whole for the opportunity to pilot this project. Again, the goal of receiving information to inform future service needs was achieved. And with that, I open it up to questions for anyone.
Thank you, Louise. Are there any questions, comments? Councilor Linda?
Thank you, Madam Chair, and through you. Thank you for doing this. That was a pilot project. What's our future plan with this? If I can ask my first question.
Yes, through the chair to Councillor Van Der Schie, we haven't done a fulsome review of all the data that we collected yet. But what we can say for sure is at the very least at the end of the pilot, there was evidence that there is need for outreach, but not necessarily in the format that we delivered it in through this pilot. So it was sort of twofold. We believe that there is a need, but to do it in the way we did it, it was sort of overkill. We don't need to do it in that way. So there was lots of discussion about going back to the table and thinking about a different way to provide outreach service when it's needed, a bit more maybe of an on-demand service, but this will require some more brainstorming. And the other challenge, of course, was staffing. So as we've said in the report, this was a project that was additional work for all of the staff that were involved from all of the programs. So doing without further staffing, we need to be able to brainstorm a way that it allows us to provide outreach services without stretching the mandatory services of all of those partners in their regular duties.
Thank you. And if I could continue. The area that you did the pilot in was both Haldeman and Norfolk. How far from towns did you go? Like, did you go to smaller communities to see if there was a need? Or did you concentrate your efforts such as in the larger communities that we have? How did you determine where to go?
Yes, through the chair. Yes, we did both of those things. So because most weeks we were receiving either reports from the community for targeted outreach. So we were asked to go to specific locations. That was the first priority week over week. But where we didn't have those reports, and again, we didn't know of any known individuals that we were trying to engage, we did go into lots of the more remote areas of Haldeman, Norfolk, because the team was in pairs. it was easier to get out to some of the more remote locations and walk some trails and walk some beaches and other things. So for sure, the teams used their expertise and experience week over week to decide where to go. And they did make an effort to go as far and wide as they could across the two counties.
Thank you. It's Councillor Van Passen.
Thank you, Madam Chair, and through you. Last month, we dealt with a report that the province had doubled the funding for homelessness. We're doubling the staff complement for that area. So can I assume that some of the requirements that this program was looking after is going to get absorbed into that other program? Maybe in a different way, but dealing with some of those same needs?
Yes, for sure. Again, when we initially started to write this report, we didn't know about the staffing increase because it's just come to council last week. But now that we have that approval for the staffing increase, we will be having some, again, conversation with all of the 4 partners involved about a way to do targeted outreach in the most efficient way we can with the complement. The homeless prevention team, through the approvals last week, was approved for a couple of additional staffing, but the other teams involved have not necessarily received any additional staffing. So it will continue to take some planning and working out of logistics for how we can continue to do outreach in the community as it is needed, but in a targeted way and in a more timely way as best we can.
Thank you for that. Any further discussion? Councillor Duffy.
Thank you, Madam Chair, and through you, Louise, thank you for the report. On page 5, it says, in terms of the goals, the second goal was a more fulsome service at the first point of contact, 152 interactions, all were helped. I guess I'm wondering if you were able to, I don't know, add percentages or rank what the most required need was. What would you say those were?
For sure. I don't have that data directly in front of me, but the highest, for sure, what the teams will tell you, even anecdotally, is that the highest need was in mental health and addiction support for the folks that we found either living rough or just, we did have a lot of interactions with folks who are not actually living rough, but they were perceived to be. And in those conversations, we often found that people did have somewhere to live. But they required all kinds of other health supports in order to be stably housed.
Okay. Thank you. And another question, and again, through you, Madam Chair, also on page 5 in the second paragraph, it says staff are working on a deeper analysis of the data received and considering options for changes to future program implementation. Can I get you to maybe summarize for me what some of those considerations may be?
For sure, through the chair to Councillor Duffy. One of the things that we found in the pilot was that going out once a week for a full day wasn't the best use of everybody's time. That there were sort of 2 problems with that program design. One was that we often received a report to go see somebody, you know, anywhere from 3 days to 7 days prior. And because we were relying on that outreach team the same day every week, you were sometimes waiting 5 or 6 days to get out to see somebody after a report was there. So it was sometimes very difficult to connect with people. They maybe weren't there anymore. They maybe weren't there the day that we went. So we did find that a very, you know, specific day was sort of not the most efficient way to deliver an outreach service. We really wanted to find a program design that's going to allow us to do some kind of on-demand type service. Again, recognizing when you don't have a dedicated outreach service anywhere in the community, on demand can be very difficult because you have to try to coordinate several different types of staffing, people from several different teams or organizations, and then be available when somebody calls, you know, as quickly as you can get out there. So the other thing we found is that Norfolk demand was higher than Haldeman. I don't know that that's a shock to anybody, but the other piece of the program design was in trying to understand, again, where to target assistance without, you know, leaving one short and, you know, one overloaded. So there was just a lot of logistics to try to work out in a future program design. And those are conversations that we still have to have.
Thanks for that. Madam Chair, if I may continue.
Yes, go ahead.
Thank you. If I could ask perhaps Syed or Stephanie then. So we've just heard from Louise, more information about the report, sort of more one of the most required needs to be mental health and addiction support. I know this has come before this table before in terms of, putting together a mental health promotions team. I'm wondering where that's at and what that looks like moving forward.
Thank you through you, Madam Chair. So I can respond to that. So currently we are in a process of coordinating and collecting more data about those kind of services within Haldimand and Norfolk. So hopefully by next year, we are going to have a concrete program about mental health and addiction services.
Sorry.
Thanks for that update.
Sorry, Councillor Duffy. Maybe we could reach out to the OPP. I know that they've started a program and they're just initiating it now, where they go out with an officer and a mental health worker to respond to crisis. It's similar to Coast and Hamilton, except currently they're only doing a day shift. But maybe as our Health and Social Services team, we could reach out to the OPP and maybe coordinate, something better, something that will provide services, after hours. We can look at what they're providing, so we're not overlapping the service. Maybe we work together, provide better service.
Thank you, Madam Chair. I think that's a wonderful suggestion. And OPP, they are part of our harm reduction action table, so we definitely coordinate with them. Thank you.
Is there any further discussion? Seeing none, could I get a mover to receive the donation, please? Thank you, Councillor Linda. Seconded. Mr. Van Passen, all in favor? Carried. Thank you. Thank you very much, Louise. Next up is 8.2 Public Health, 8.2.1 Medical Officer of Health Update, Association of Local Public Health Agencies, 2023 Annual General Meeting Resolution, H&SS 23-043. Thank you. Thank you, Madam Chair. June. For me, general meeting. And I was trying to think what I could share from that meeting. So I decided to share just the resolutions. It was a very rich and rewarding meeting. So the reason I decided to share the resolutions is that it speaks to how local public health integrates with all the other health units and how we can work together collectively to achieve an end. So one of the jobs of public health is to work collaboratively with other parts of our society to normalize ways of doing things that promote health and well-being. So it's sort of a health in all policies concept. And so that it's not only public health that plays a role in promoting that type of society. It takes all of our partners. We just saw social services is distinctly a very important partner. And it's also that public health has to be a little bit a step ahead in that. So we now have a homelessness issue across the province and probably across the country. And probably there were warning signs about that over the last 2 decades. And so also through our surveillance methods, we attempt to try and identify those problems and talk about them before they occur. But we can't do things unless we do it with other departments of the government and ensure that we have our community members engaged. So by having these resolutions on, on Alpha's website, it sort of is also a call to other organizations to look at these issues. So it's part of, it's a very small step towards raising awareness of a certain issue, and then also letting others know that this is how we think we should address this issue. And so at this year's meeting, there were 5 issues brought forward. I think there was that I posted 5 here. There was actually a 6th one, but that had to do with just how the association does its business. So I left that one off. So just to highlight them quickly, first one is on just raising awareness about the fact that we have to deal with smoking. We've gotten smoking down to about 18% of the public, which is really quite phenomenally good. But the goal, but we just don't want to leave it there. And there is growing concern that with the introduction of vaping cannabis, that this may actually cause a potential resurgence in smoking use. So this resolution was the call to, okay, let's put this back on the table. The other one on improving indoor air quality is the type of resolution you put forward when there's a window of opportunity. I think through the COVID pandemic, we've all become really aware of how important indoor air quality is. We always kind of knew it, but this sort of highlighted it even more. So again, it's just a call for Alpha to work with other agencies to raise this issue, maybe to make some small changes in the building code, which would then have long-term benefit. So the one on ending underhousing and homelessness, this was actually started with the Association of Municipalities of Ontario. Alpha works closely with that association, and they asked Alpha to support their call to action on housing and homelessness. Again, increasing the strength of their call. And again, this was strongly supported by the Alpha membership. The other issue is brought forward by the Ontario Public Health dietitians. So again, raising awareness that food has gotten incredibly more expensive, and that the what people get in terms of social assistance through Ontario Works has for a long time been substandard. So again, once again, using this window of opportunity with inflation and rising food rates to call for increases to food affordability. And lastly, the National School Food Program. I know that many of our citizens in Canada, fortunately, are well off and do send their children to school with, a good breakfast. But from an equity basis, as to not draw attention to needy children, the general thinking is that a national school nutritious program would be a good step forward. And this is another moment to bring attention to those factors. So sharing these for your information. Thank you, Dr. Locke. Great information here. Is there any questions? No questions? I just wanted to reiterate, absolutely. I'm glad that they're looking at the indoor quality. That is something that I was saying to myself and my family all through COVID. They just have to improve their quality in our long-term care settings and our hospitals and their apartment buildings and such. So I'm happy to see all of them actually. The nicotine strategy in Ontario, they really need to look at the vaping issue. More and more are turning, well, I'm not smoking, but you're vaping, the same thing. So getting nicotine, that's it. Which I don't yet have.
But the vaping issue was added to the resolution.
That's great. Thank you very much. Are there any other questions or comments? Done? Could I get a mover, please, to receive information? Thank you, Councillor Van Passen. Seconded. Seconder. Sorry. Thank you, Councillor Duffy. All in favor? Carried. Thank you. Next is 8.2.2, Medical Officer of Health Update, Board of Health Orientation and Education Session, HSS 23-044.
Thank you, Madam Chair. Yes, so this is for decision. As essentially the staff thought that the staff are interested in providing you with an education session or sessions. It's also a requirement of the Ontario Public Health Standards that new members are aware of their roles, but that we also provide continuing education programs for board members who have been a member for a while. So we did put a few suggestions down for you to think about that we might like to, that board may like to consider that the education sessions be spread over several months. We just thought whacking you with a whole lot of information all at once, that my brain gets saturated pretty quickly. So and you have a lot on your plates. So perhaps parceling it out in small bits. We thought we would really appreciate allowing informal discussion so that we could have a good conversation about these issues. We also thought that we would like to ask a few outside experts. Alpha has a lawyer that works for it, and who will come free of charge to talk about the legislation. He gives this presentation to many other boards, so we could invite individuals such as that. So I'll leave it for you to make further decisions.
Thank you. Councillor Van Passen.
Thank you, Madam Chair. When I read this, I got thinking our clerk's department here has developed a new system where we, every other month, we have a council workshop to deal with specific issues kind of thing. And with the Board of Health members is a requirement to get specific training. And I wonder whether we could maybe arrange like the sort of like we do what 9 till 3 workshop, but if we could organize that and then invite all of the council to that workshop to get an better understanding of the rules and regs that go with the Board of Health and all the other any other updates that we'd like to provide. But I think that might be a very good option to have for a one-day affair kind of thing.
Thank you, Councillor. I think that's a great idea. Thank you. Councillor Linda?
To carry on with that, I think the seminar, if we have a day seminar, spread it out. It doesn't have to be, a full day. It can be a half day. But I do agree that both councils should be there to understand what's going on and get the update that we need. Sometimes we get a lot of information bombarded on us, and we always don't get that really technical things that should stay in our brain. So I think it's a great idea, and maybe work it out between clerk and clerk. So to bring some sort of thing and work out the
Thank you. Any further comments or questions? Should I put a motion on the floor to get this education between the clerk and the clerk to organize an education session between both councils, Alderman and Norfolk? Second a mover for that? Thank you. Councillor, no, there's Councillor Linda, thank you for your mover. Councillor Van Passen seconded. All in favor of that? Carried, thank you. Next is 8.2.3 called the Norfolk Health Unit Risk Management Registry Update, HSS 23042.
Thank you. Through you, Madam Chair. I'm Hughes Marcia, and I'm on Todo, Program Manager for Professional Practice and Quality Assurance, to present this report. Thank you.
Good morning. Through the chair to the committee, I will present the Haldeman Norfolk Health Unit Risk Management Update Information Memo, Report HSS-23-042, to be received as information. So in January, the Risk Management Registry was presented to Advisory Council and Board of Health. Councillor Duthie asked for an update to keep Advisory Council and the Board of Health informed as to the progress of risk mitigation. Attached to the report is the updated Risk Management Registry. As you can see, we have been able to make some changes which address and ultimately reduces some of the risk to the health unit. We have made significant progress in how personal health information is secured, and we continue to work on putting further measures in place. We continue to work with the Norfolk County Clerk's Department on file digitization and also retention. We are continuing to recruit staff when positions become available. We have been posting positions as soon as possible to minimize the impact on the staffing gap on the existing staff. We continue to work to address the risks and also to identify and mitigate other potential risks to HNHU. And by addressing these items, we will be able to decrease the overarching risk to HNHU. Thank you.
Thank you, Marcia. Are there any questions, comments? Being none. Can I get a mover, please, to receive the report? Thank you, Councillor Duffy. Seconded. Councillor Van Passen. All in favor? Carried. Thank you. Next is 8.2.4 Seasonal Housing Update 2023 HSS 23-035.
Thank you. Through you, Madam Chair, I introduce Alexis Atkinson to present this report. Thank you.
Good morning, everybody. Through the chair to the members of the advisory committee, today I will be presenting the HSS 23-035 Seasonal Housing Update 2023 to be received as information. Due to the legislated requirement that housing utilized by international agricultural workers must be inspected by public health inspectors, the Haldeman Norfolk Health Unit has one of the largest numbers of seasonal housing units in the province to inspect. In 2022, the Haldeman Norfolk Health Unit approved housing for 5,914 international agricultural workers and conducted 666 regular inspections and 41 follow-up inspections. The estimated cost for an inspection in 2023 is $212.25, and for reinspection, $154.90. The current seasonal housing inspection fee is intended as a partial cost recovery for the Haldeman Norfolk Health Unit and Haldeman and Norfolk counties to recuperate direct and indirect costs associated with the seasonal housing program. The county currently charges $114 per 911 address, regardless of the number of housing units to be inspected, which increases the financial burden of conducting these inspections on the tax levy. In 2022, the cost of the program was $147,710, and the actual recovery was $48,709. The fee structure creates inequities for smaller agri-food operators as they pay the same fee for 1 to 2 bunkhouses that larger food operators pay for the inspection of 10 or more bunkhouses, and therefore the fee is not relative to the services received. The Haldeman Norfolk Health Unit is proposing a change to the seasonal housing fee to address the inequities inadvertently created using the current fee schedule and to improve cost neutrality for the seasonal housing program. There is no current fee for re-inspections. Staff are proposing a change to the seasonal housing inspection fee from $114 per 911 address to $95 per unit, and a re-inspection fee of $45 for the 2024 growing season. While it is recognized this proposal does not reach full recovery, it is an enhancement that can be reevaluated when necessary. Regular evaluations of the cost of the seasonal housing program and local socioeconomic factors will assist to improve cost neutrality and reduce negative impact on the levy. In conclusion, adjusting the seasonal housing inspection fee from $114 per 911 address to $95 per unit, and implementing a reinspection fee would improve the cost recovery of the seasonal housing program and reduce inequities in the current fee schedule and improve collaboration and cooperation with the seasonal housing program with agri-food operators. Regular evaluations of costs of the seasonal housing program and local socioeconomic factors will assist to improve cost neutrality and reduce negative impact on the levy. Thank you very much.
Thank you, Alexis. Is there any comments? Councillor Linda?
Thank you, Madam Chair, and through you. I think this is an excellent idea. I think it's high time that it comes a little bit more to equity. That I always wondered why you didn't charge per unit, because you have to physically go from unit to unit. So how do you analyze a unit? Because many of the units are attached. How do you differentiate that?
So in 2021, a cost analysis was done with Norfolk County Finance as well as members of the environmental health team. That's where the original numbers came from. It takes into consideration the drive time going to and from these locations, doing measurements within the bunkhouse, as well as inspecting all of the other areas. And since Kelsey Lutzy is one of our public health inspectors, who is one of our farm leads and is very familiar with this program, I will pass it over to her to answer any further questions.
Thank you. Just to follow through the chair to follow up with your question, Councillor. Oftentimes when we have bunkhouses that are joined, we will consider them one unit and differentiate between like side A or side B. So that really comes down to the area public health inspector working with that farm on whether they're indicating that they're single units or a multi-unit that is split between the two. So oftentimes we will have joined units and we'll label them side A and side B and consider that structure as one bunkhouse. So that would be charged as one unit if this new proposal is accepted.
Thank you for that. Councillor Van Passen?
Yes, thank you, Madam Chair, and through you. I'm going to ask about the same question, but I want to make sure I understand it because I'm sure I'm going to get a little bit of flack over this, but needs to be done. Yeah, defining a unit, because a lot of our farmers have spent millions of dollars to build new accommodation for their workers. And it might be one building, and I've seen up to what, 6 or 8, call them pods within that one building. So you would consider the entire building a unit? So when you walk out of that building into another building that has 6 pods in it, that is unit number 2.
Through the chair, yes, Councillor, you are correct. So I have many of those myself where we're seeing farmers try to, especially from COVID, come up with new solutions to help, mitigate those tight living conditions. So they may be looking for the same amount of workers, but designing them differently, where you would have one large building that may have 4, 5, or 6 different pods. So when an inspector is going out there, we oftentimes look at that one building as one bunkhouse, but we would call them unit 1, 2, 3, and 4, or pod 1, 2, 3, 4, as per the farmer's request. So we work with our farmers and build those partnerships, because ultimately, when we're providing those approvals for Service Canada through the program, they need to know how many workers are approved. So we do account for each unit and then the building as a whole. So we would be working with our farm to make sure that they too recognize that that is a unit. So they're often very aware of that. And that is a consistent application across all of our public health inspectors, that we're looking at that fixed building. And then if there's multiple different pods, it's usually all assessed the same. So we would be providing that equity across the program to that lens as well.
Okay, thank you. I'll get ready to take some flyers.
And through the chair to Councillor Van Passen as well. So they would actually only be charged one fee instead of each separate pod, right? It would be considered one unit. So they would just, so for them, that'll actually, they would receive that cost savings. But then yes, for someone who just has one versus them, people could look at that as another inequity. And again, we can reevaluate that in future years and assess how many of those we have. If that becomes an issue, we can always bring that forward to council in another report.
Go ahead, Councillor Linda.
Thank you, and through you, Madam Chair. Interesting, you're going on the property, the 911 address, and there is a pod system, and usually those pod systems are attached. They kind of seem to be attached. But if there is two separate sections like this, a row of building here, and then move over the driveway and whatever, and they're not attached, then does that become a separate unit in a separate unit?
Through the chair, yes, you are correct in that assumption.
Well, that's where we'll see some, because you're coming to the 911 address. You're just going from this to this to this to this. Okay.
Yeah, so we're looking at each individual structure as a unit, and then they would be paying for each unit on that property.
Okay. Try to understand that better.
Councillor Van Passen.
Thank you, Madam Chair. I just thought that I should be a little bit consistent here because the last few meetings when we have reports coming to council about trying to achieve cost recovery, I will ask this department as well that while we're looking for cost recovery, we should also be looking for ways to reduce the cost, not just cranking up the fees all the time. So I'm sure that will be in, find better ways, more efficient ways, and build some efficiency into the system to try to keep our costs down and not just every time we do something different, we just add more money to the fees. So I'm sure staff will be working on those ideas as well.
Thank you, Councillor. Are there any other further comments? Seeing none, can I get a mover to receive the information, please? What else? Okay. Councillor Duffy, thank you. Seconded by Councillor Linda, all in favor. Carried. Thank you. There's nothing under subcommittee reports. There's nothing under communications, other business. Nothing. Oh, sorry, Councillor Linda.
Spotted, since we are health and social services, just a reminder that we did get some calls, and I'm thinking that some things that they looked into is the Northview about the heat and the no lack of air conditioning, if that will be just reported so it will be addressed. Thank you.
Okay, thank you. Our next meeting is Monday, July 24th, 2023. Virtual Microsoft Teams virtual meeting. Thank you. May I have a motion to adjourn? Councillor Duffy, thank you. Seconded by Councillor Van Passen. Adjournment at 10:38. All in favor? Carried. Thank you very much.
Thanks, everyone.